Okay, so we're going to use AccessHSI in two major use cases. The first one is the administrator. So I'm first just going to log in. The main difference between the start screens for the administrator and the user right now is this My Account button. If you type in a member number, you might not get patients because they're not linked to the administrator. But you can still create members from the admin the same way you would in a provider. So the first thing we're going to do is look at My Account section. There's the list manager, which I think has too many rules going on right now, so I wouldn't or don't know how to completely manage these options, but they should be manageable. Probably need to be edited in the database as well if we're going to change anything. But this is totally manageable from just the UI. For example, I just created this character, Mr. John Ham. Gave him this email address, and why don't we walk through that? So we'll create John Spam. If you hit save, it'll give you the required fields. Which is basically first name, last name. They have to be active if you're going to test them out. You have to give them a role. In this case, I'm going to give them a provider role. Give them a security level. And then this is required because of a bug, so we should probably look into that. But I'll save that. Save his password over here. These are some values that were created in the list manager setting. So we want to take a look at that. Same with the affiliations and these licenses. Let's say he's a licensed psychiatrist in the state of California, and that's his license. None of these fields, like this for example, is verified. They don't connect to any service, they're just for record keeping. But we can save them. And now John Spam is in here. Obviously, these users are separate from these members, which are patients. So what we're going to do now is log off. I'll log in as John Spam, our brand new user, and we're going to look at a patient that already exists. So this patient pops up. Now that we're in the provider role, you can see her. We can see John Ham's work, we can see Wilson Parker's work, we can see David work, and what we're going to do is actually work off of someone else's work. So all of the work inside AccessHSI is available to us. We can save it, we can complete it, we can agree with it, and we can get our own algorithmically generated guideline, just like that. You can see how it ties into the last report. Now that I've done this a couple times without changing much, they're all starting to line up. You can export from PDF from here just by clicking this. It'll download the report. But now, why don't we take it back? Create a user, or member in this case. So again, similar to the admin section, if you want to create a patient, you're going to get the required fields by hitting save if you've forgotten them. So we'll do 1099, just like the taxes. We'll call him Taxman. I have to give him a gender because of the way that the weight and body weight is calculated in the medical conditions for anorexic and obese patients. Gotta give a date. We have to get a security level. And that's it. Taxman. So he's got no encounters. So his demographics, we can always go back and edit. All these fields aren't necessary, essentially, but they're all available. You've got the drop-down lists. None of this stuff affects AccessHSI's algorithms in any way. They just are required or they're fields that are available for documentation purposes. They won't show up in a report, but within the UI they're available. So main function is this create the encounter. So we have two types. We have the MSE, which is a standard form. Stands for mental status exam. And we have the HSI, which stands for health status indicator. We check out the MSE, you can see it. It's not very complex. All of this is standardized. You can go from field to field using your mouse and keyboard. The first value is always the quote-unquote normal value. And that continues on. With AccessHSI, you can jump from field to field. That's true in basically the entire application. And just like an HSI, if you hit complete, it'll lock the record. None of these fields are now editable, and the report is now available for generation. And now it sits inside our encounters box with the option to view, copy, archive, or see the details. Now let's create an AccessHSI. So AccessHSI is technically 7 domains with the overview page as an extra free field, unstructured data addendum, essentially. So users can say their main complaint: patient is sleepless in Seattle. They need a girlfriend. Obviously those aren't real, but that's how these text boxes work. They have character limits, but you can pretty much type a good amount. Obviously the application encourages you to do most of the documentation in the structured data fields of the 7 domains. In the symptom severity domain, the first and most important for the algorithm is choosing what type of mental health disorder they have. Is it mental health, substance abuse, or both, for the focus? these eating disorder, mental health, and substance abuse areas are the main areas of mental health treatment. In this field, we'll be changing it slightly, but for now, show you how it functions. You can use the type ahead feature to drill down to exactly what you need using numbers, the DSM codes, or words, and select. If you select from here, you'll have the tree, and then with the verify button, these rules are basically guided by the subheaders. So 3 or more, for example. To get this criteria met, you have to get 1, 2, or 3. If you hit that, it's not met because you've met less than 33% of the criteria. With this, we should get suggestive. If that doesn't meet the criteria, then now we dev. You can always So that's the threshold, is that at least these two have to be clicked, and probably, yeah, at least 2 of these items. Percentage wise, that gets us into the suggestive of. With all 3 met, as in all 3 in this area, and this one, they've met the criteria. We'll also be getting rid of this feature, but the main function of searching for diagnoses will remain for going forward when we switch to DSM-5. Another change is the combination of Access1 and Access2, and the ability to go from, instead of 1 through 4 and 1 through 3, 1 through N. So adding diagnoses through the UI. Same for substance abuse. Instead of 1, 2, 3, 4, we will have primary plus N number of diagnoses for substance abuses. This is an unstructured data. This is not. If you save a record, it'll give it a positive ID number. So this one, instead of a negative one, which means it's not being recorded in the database yet. One of the main components of AccessHSI is this blocking of text fields without having the prerequisite field clicked in. So that's true in this area. That's true with radio buttons. Lethality section is the one where it's the most significant. By unchecking, by checking danger to self, you'll have 2A through 3B. If you uncheck that, you'll go straight to 7. If you do to others, you'll get 4A, 4, and 5. And even with gravely disabled, you get 6. If you check all 3, you'll have 2A, 3, 4, 5, 6, and 7. This type of UI is true throughout AccessHSI, and it allows for users to navigate quickly without getting too bogged down, as well as filling information in as they receive it, because interviews aim for structured, but sometimes you'll get piecemeal information. For example, a patient talking about the last drug that they were using. You would want to be in symptom severity. They forgot that they used to use another type of drug, and then they'll go and talk about the last place that they were at, because sometimes those are connected. So that's where AccessHSI's UI comes from. And if a user forgets that, for example, occupational therapy is something that they were under, but they didn't realize it was just a type of service. So it's some type of protection. In the medical conditions is another place that we'll be making some changes. For example, ICD-9 to ICD-10. Basically, these numbers will be changing. So there's that way to add ICD-10 codes, as well as this one. The active should remain the same, and the other thing we'll be changing is the ability to add n number of them. Same or similar changes to the drug section. Both psychotropics will no longer be limited to 8 drugs or 10 drugs, but n number of drugs. Removing will also have a slight UI change. Instead of getting rid of the drug from here, they should have buttons or UI features to do that. So, another larger hidden or menu is in the provider resources. The severity of these ranging from none to 1 week worth of services, all for different levels. So because these are all essentially the same, the field doesn't disappear, however it does change, and it will ask you to clear the services. In each field, there's the comment section, comment in the report, and comment not included. The default is that these will not be included in the report, but just for the user. If you check the box, then these additional comments can be included in the report. So for example, actually I don't think I saved it. At any time, you can view a version of the report that does not contain the algorithm's decision. So, like we saw, comment in the report, in the previous section, comment was excluded from the report. If you complete an AccessHSI, you will no longer be able to edit, but you'll be presented with the algorithm's decision for meeting the guidelines. These are the medical necessity guidelines, and this one suggests urgent inpatient. If you agree, you'll get the ability to confirm. If you don't agree, you cannot confirm until you've selected a level of care, typed a rationale, and then hit confirm. Now when we see the patient, you get a full view of the user's input, the system's recommendation, and all of the fields turned into full English, including the DSM. If you go to the second page, you'll see a map visually of where the risk factors are. As you add more to the report, it'll approach the illness setting. If you close, want to go back to the encounters to see where you're at, you just click the encounters tab. It gives you a number of the available encounters or completed encounters. And of course, you can copy and continue where you last left. If a user wants to cancel, they can cancel a report. If it's pending, they can also archive. You can archive canceled reports as well as completed ones, and both will disappear. Administrators can see both canceled and archived reports. Users will not see them. We're back to our blank AccessHSI. And you can log out.